Good morning, friends, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Sridhar Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. So this is quite convenient for the study. You can make use of it. Thank you very much. My dear friends, we have been discussing about rickets in children since last so many classes. And by the time now we have finished the basics of rickets, and we have seen the basics of vitamin D deficiency, calcium deficiency, phosphorus deficiency, hypophosphatemia, hyperphosphatemia, etc. How they contribute in manifestation of the rickets in different ways. So today our notes we will see the pathophysiology to some extent and more importantly the clinical presentations. Now pathophysiology we have discussed many times, but still there will be a defective mineralization of the bone matrix at the growth plates, as we know. This leads to growth plate problem in the cartilage especially, and the osteoid continue to expand but mineralization is inadequate. Okay, so growth plate cartilages will be there and osteoids keep on going and expanding, but mineralization will not be there because there is a problem with the vitamin D, calcium, etc. So mineralization will not take place. The bone becomes soft. So bone becomes soft and there will be formation of the different deformities like bending of the long bones, double malleolus, recurrent fractures, etc. Okay, that is because of the softness of the bone. Okay, at the growing end of the bone is very soft because there is no mineralization taking place. Only bone is expanding. The metaphyseal end of the bone width increases. Because of this, at the metaphyseal end, the bone width will going to increase at the distal end of the metaphysis and the growth plate. So we get symptoms like wrist widening, etc. So now that means a metaphyseal end will be there. That will be in the upper end and lower end both, isn't it? Shaft joined with the epiphysis. The epiphysis will be there in the upper end and lower end. Just above the epiphysis we will have the metaphysis. So in the both the ends, the metaphysis and the bone width will going to increase because of the expansion of the osteoids. With the improper mineralization, the bone becomes soft. Okay, so that leads to the deformities, especially at the lower and upper end, especially epiphyseal end. So usually we will get wrist widening because of these reasons. Okay, in other long bones also there will be so many changes that we'll discuss, but especially whenever we talk about rickets and ricketic finding, we will go for a wrist x-ray usually in the children or child, because this is also one of the long bone, and in the upper and lower end of this particular long bone, so ulna and as well as radius, so there will be changes, and we are witnessing that changes through the x-rays to diagnose the disease. That we'll see now. What are the clinical symptoms which are present in the rickets? We will try to look at one by one because it's a very big disease and wide presentations will be there. Now, first sign of the rickets is usually seen at 6 months. Already we have told that ricket is a disease of early infancy. It begins in the early infancy, although manifestation takes place later after 1 year and all, but disease will start at the early infancy. First of all, what we will find is ping pong ball appearance. Okay. So in the cranium, already the cranium of the newborn baby is very soft. It is not completely ossified and completely mineralized and all. It is soft. But you will get a ping pong ball like appearance of the bones, cranial bones. Okay, that may be considered as one of the initial very primary symptom. Okay, so in the first 6 months, okay, you can suspect the disease. Then 6 to 1 year, talking about the late part of the infancy, 6 months to 1 year, you will get the frontal bossing. Okay, there will be frontal bossing. Then rosary, ricketic rosary may be seen. Then comes Harrison sulcus. Harrison sulcus is nothing but a transverse horizontal line due to diaphragmatic pulling. Okay, the diaphragm pull the ribs. Okay, if the ribs are very soft, then they will be able to pull down. Okay, so that leads to a groove-like structure there, and that is called as Harrison sulcus. Then widened wrist. So when the child start crawling and creeping, now see, there will be softness of the bone in the lower end of the forehand, isn't it? Now, first thing what the child will do is child is not first walking, isn't it? So in the beginning, early part of the infancy, baby first start crawling and creeping. When the baby is crawling and creeping, what comes to action is that is the wrist. Okay, so it will give the wrist pressure and then it creeps. Okay, so therefore pressure will fall on the wrist. So earliest changes will be seen in the wrist. Therefore earliest changes will be seen in the wrist. So wide and wrist when the therefore we'll go for X-ray of the wrist. Okay, so wide and wrist. So when the child start crawling and creeping, there will be pressure on the wrist and that will be elicited. Okay, therefore we should consider wrist X-ray as the best. Why? Because it is helpful to identify the ricketic symptom at the earliest. Okay, because first of all the pressure falls there. After child start walking and walking locomotor milestones of walking, then only we can see the varus, valgum like deformities. Because when child start walking, the pressure will be there, load will be there, then the bone deformity takes place. Anyway, now if you talk about 1 year, after 1 year, there are so many symptoms which helps to identify the rickets after 1 year. For example, double malleoli. Okay, that's in the lower limbs. Double malleoli. Just above, below, at the region of the malleoli, just above the malleoli, you find another malleoli-like structure because of the bone deformity. Actually, it is not malleoli. The bone is deformed. That gives the appearance of another malleoli. So therefore, we'll call it as double malleoli. I will show the figure. And delayed dentition may be there. So delayed dentition may be also there. That is one reason. Delayed AF closure, interfrontal closure may be delayed. And bowing and knock knee, varus and valgum deformities or windswept deformity, etc. will going to start. Okay, so these are the clinical symptoms when we see month-wise, 0 to 6 months, 6 months to 1 year, and above 1 year. Now, these are some of the dentition problem which can occur because of the rickets. And these are the deformities, as I told. See, these are the lower limb deformities. Windswept deformity is there, varum is there, valgum is there. Okay. Now, what are the other symptoms? And if you carefully see, or even you can see the double malleolus. Otherwise, I will show the double malleolus figure. One more figure is there. I will show that. And all these figures are taken from the YouTube just for the educational purpose. Okay, clinical symptoms. Other symptoms are pigeon-shaped chest, okay, failure to thrive, pot belly, proximal muscle weakness, visceroptosis, downward displacement of the intra-abdominal organs, increased risk of fractures, proximal myopathy, seizures, and also vertebral anomalies. These are the other symptoms which are related to rickets in the due course of the time. Okay, so pigeon-shaped chest is quite common. Ricketic chest is also there. Okay, so pigeon-shaped chest, racketic chest, long flat chest, okay, ricketic rosary, horizon sulcus. So they are all associated with the racketic chest. Then pot belly will be also there. Pot belly means protuberance of the abdomen. Okay, pot belly. Then failure to thrive will be there because of the various reasons. Proximal muscle weakness is also common because the problem is there is the calcium. Calcium is very important for the muscular contraction, you know. So therefore, this muscle weakness, etc., can occur. Now, let us see one by one. Due to the frontal dominance and the flat occiput, the shape of the skull will be square, and it is called as caput quadrantum. So this is quite possible in case of a ricketic child. Okay, there will be frontal prominence will be there. In the meantime, the occiput is become flat. Okay, so because of this prominence and occiput become flat, so this gives them a square shape to the skull, and we will call it as caput quadrantum. So this is seen in case of rickets along with the ping pong ball appearance. And due to the prominence of the sutures, there will be hot cross buns appearance. Now the what you say? See, this is ping pong ball appearance. Okay, ping pong appearance, and I will show the hot cross buns once. And so that things will be very clear. See, this is appearance of hot cross bun appearance. Okay, so in the skull, what happens? Ping pong appearance will be there, prominence will be there in the frontal area, and in between the sutures which are present in the skull, so they are become more prominent, and this gives the appearance of a hot cross buns appearance. Okay, frontal bossing with a hot cross bun. Okay, it's a hot cross bun. It looks like that. In the bakeries, later they will going to cut it. Okay, so hot cross bun appearance. So that is also typically seen in case of rickets. Then signs in the chest. If you see ricketic rosary, we know that, and we will see what is ricketic rosary. The rosary will be round in case of rickets, while in the scurvy it will be shooting or sharp and also painful. Whereas in case of ricketic rosary, which is present in the rickets, so that is not painful, but it is round. Whereas in case of scurvy also we find the similar finding, but in scurvy the difference is it will be painful. Okay, that particular rosary, that particular appearance, prominence is painful, and also it is not so round, it's little sharp. It is little sharp. So that picture also I will show. I will try to show now only if possible. Okay, we will find it later, no problem. In the due course of the time it will again repeat it. Okay, so scurvy you can remember yes. Okay, scurvy it is sharp. Ricketic rosary you can remember RR. In rickets it is round. Okay, so Harrison's groove will be there, indentation of the diaphragm will be there because of the indentation of the diaphragm. Now shape is usually the chest become pigeon shaped, pectus carnatum, we will call it as pectus carnatum due to the prominence of the sternum and the ribs. So in the back, if you see, there will be scoliosis, kyphosis, lordosis, and then wind-swept deformity. Wind-swept means one side there is a varum, another side of the leg will be vulgum. So both the deformities in the same child. One side leg is showing the varum deformity, another side of the leg, another lower limb is showing vulgus deformity. So that is called as wind-swept deformity. Okay, now in the extremities, if you see, there will be enlargement of the wrist joint. I told why it expands. There will be widening of the wrist joint. Coxa vara will be there, knock knee will be there, and bow legs will be there. Okay, so now due to hypocalcemia, calcium deficiency is always there. So because of the hypocalcemia, calcium is less. So that leads to hypocalcemic tetany. Tetany will be there. Therefore, even the seizures may also occur in a patient of rickets if the cause is because of calcium metabolism problem. Okay, so there may be seizure, then stridor may be there, then also there will be laryngeal spasm. These are all because of the calcium problems. Okay, hypocalcemia. Less amount of the calcium leads to all these problems, because for the muscular function, the tonicity of the muscles, etc., that will be maintained by the calcium ions. Now, vitamin D contraction is mainly mediated by the calcium. Okay, that is very important. Calcium ions, calcium channels. Now, vitamin D deficiency is common in breastfed babies, as we have already discussed, while calcium deficiency is common after the weaning period once the pod is started. Now, during the breast milk feeding period, usually up to 6 months, or you can take up to 1 year to some extent, but maximally up to 6 months. If the ricket is coming, the problem will not be mostly with the calcium, problem will be mostly with the vitamin D, because there will be a lot of problem for the vitamin D, because breast milk is also deficient in vitamin D, and the baby is less exposed to the sunlight. So chance of getting rickets due to vitamin D deficiency is more. Whereas after 6 months, if the ricket starts, then most commonly it is not because of the breast milk, most probably it is because of a calcium deficiency. You are giving such a weaning food or complementary food which is less in calcium. That may be the cause. Then if it is not responding to any of this calcium supplementation or vitamin D supplementation, that comes under the category of refractory rickets, what we have discussed. Vitamin D dependent rickets, where the problem is not with the intake, the problem will be there with the formation of the active form of the vitamin D, or some enzyme problems or receptor problems, or some chromosomal problems, etc. Now, during the infancy, early stage, due to the growth plate failure, so this happens in those who epiphysis is not at closure. So changes will be seen, may vary from patient to patient, and also as for the severity of the deficiency, duration of the deficiency, and also the stress on the individual bone. Okay, so presentation जो इसमें आता है, so that depends upon many factors. Now vitamin D deficiency is there, but ricket finding may appear according to the severity of the deficiency. If the deficiency is little, mild deficiency, you cannot get all the symptoms. If the deficiency is very severe, you get all the symptoms. The duration of the deficiency, for how many days this problem was there, for 1 or 2 months this problem was there. Luckily that was diagnosed or identified quickly later onwards, and we have started with the nutritional supplementation. Yes, you may get only few symptoms, later it is get corrected. It may also depend on the stress on the individual bones. The problem is there, but the bone is not taking any load, for example. Okay, so then although there is vitamin D deficiency or calcium deficiency, there may not be much deformities developed. But if the stress on the bone is more, baby is walking, and then the stress will be there. Suppose if the baby is not walking, maybe due to some other disorders, baby is not walking, developmental milestones may be delayed. So that condition, the deformities may not be there up to that extent, although the problem is there. For example, during the first 6 months, more stress will be on the head bones, isn't it? Because baby is in the prone position only. So more stress will be on the head bones and the abdomen and also the thoracic bone, isn't it? Prone or supine position, whatever may be. In the first 6 months, the load will be given to the stress will be given to the vertebral bones, to some extent the thoracic bones, to the head bone, okay, etc. So changes will be there in that bone. So they have the major skeletal changes in that area. But later when the baby start walking, the stress will be more on the lower limbs. It's on the legs, and the long bones of the lower limbs may be majorly get affected, and that leads to the deformities like varum, vulgum, etc. Okay, softening of the occipital bones, parietal bones will buckle inwards and outwards due to the pressure, which is called as craniotapes. And this is the craniotape, as we have already discussed. And this is pot belly and delayed working. See, the child will be having hypotonia. One more symptom. The hypotonia is again because of muscle loosening, in the sense muscle tone is not maintained, calcium is not there. So that leads to hypotonia. You can appreciate. All these pictures are taken from the YouTube just for the educational purpose. Okay, this is about the pot belly, where there is an enlargement of the abdomen will be there. Okay, that is also because of the looseness of the abdominal muscles. Now, the ends of the long bones demonstrate that same knobby thickening at the ankle and palpation of the tibial. Now, you can see double malleolus syndrome here, Marfan sign. It is also called in this picture. If you see carefully, one malleolus is there, just above that, one more malleolus is seen. Okay, so that is because of the softening of the bones leading to deformity. That gives the appearance of another malleolus. So in the left side picture, so it's very clear that there will be double malleolus. One malleolus here, another one is down. Now this is other pictures related to the same. Swollen wrist will be there, genu valgus and knock knee. Okay, this is windswept deformity. One side it is vulgum, another side is varum. Okay, rachitic rosary, if you want to see, this is rachitic rosary. It is round shape. Okay, as we have discussed, it's round and not painful. Whereas same in case of scurvy, it will be painful and it is sharp. Okay, painful and sharp. Now if you want to see, this is whole round, that means as a whole, what are the symptomatic presentations and a range of a spectrum of symptoms which may be present in case of rickets. In the bow legs, wide knee joint, wide ankle joints, pelvic deformities, wide wrist joint, odd-shaped ribs, pigeon-shaped chest, spine deformities, odd-shaped skull, then stunted growth, frontal bossing. Okay, so these are the picture that you can use if you want to see. One more problem which can occur is violin chest. See, just like a violin. Okay, violin का जो portion होता है, वो जो है नीचे के abdomen का portion है, violin का जो वो body part हो गया, और ये ऊपर वो जो उसका hand वाला portion हो गया, handle वाला portion, violin chest. So that is also seen in case of a rickets as a symptom. Now this is bow legs and knock knees, and you can appreciate the enlarged wrist. And these are the different pictures of the same. So in the next class, we will see the most important thing, that is X-ray changes in rickets. So till then, goodbye. Thank you very much.